Welcome to Talking the Whiz Quiz, an HR guide to drug testing. This podcast is for HR professionals, business owners, managers, anyone who wants to understand workplace drug testing in a simple and down to earth way. My name is Lori Oshman, and I'm here with Gary Oshman. Together, we own AZC Drug Testing. We are a national consortium and third party administrator company. But really, our goal for our podcast is to talk drug testing and all the things that are part of that world. And we're here to help companies and individuals to better understand what those programs are and how they work. Um, Gary, if you want to introduce yourself a little bit and give a little bit of your history, because you've been in this industry for a long time. I'm relatively new, but learning every day. And again, want to share what is it that the knowledge that we've learned over the years. Again, if you could introduce yourself.
Yes, I'm Gary Oshman. I am the president of AZC Drug Testing. I got into this industry over 30 years ago, working in trucking safety. And after working for a trucking company in their safety department for a number of years, I started my own excuse me.
Drug testing
Basically,
company.
I started my own motor carrier safety compliance company, that helping companies comply with the federal rules for truck drivers, including all their driver qualification hours of service requirements, vehicle maintenance, and also drug testing. I got into the industry right when the U.S. Department of Transportation was mandating random testing for all the different transportation industries, and and then within a few years of that, when they start mandating mandatory alcohol testing, I was actually in the second class that the U.S. Department of Transportation ever put on certifying breath alcohol technicians for U.S. DOT alcohol testing. But I started, the drug testing and alcohol testing component of our business definitely far outgrew the rest of it, and we have focused, a lot more in the last 29 years on the drug and alcohol testing side of the business, where we now manage programs for companies in all 50 states and a couple U.S. territories. We started off as a local company and kind of expanded out with our clients into other markets, which eventually got us into the being really a national provider.
And with that, you really have expanded out beyond motor carrier to all modes of transportation and the drug-free workplace programs for non-mandated employees.
Exactly. We started to see with some of our clients that that they had a handful of CDL mandated drivers, but that they tested all of their employees, hundreds of employees. So, I realized very early on that I needed to learn all the rules for, running drug-free workplace programs, so we could be that single provider, for that company, not just handling their Department of Transportation regulated employees. So yes, we have, definitely over the years have kind of got into a lot of, as our company grew, added a lot of additional services to help those industries.
And you've really focused and honed in on kind of that HR employee screening side of drug testing, and then some of those tandem programs that go with that: background checks, motor vehicle reports, fingerprinting services, some of those things that kind of work in tandem with the drug testing. So, are we ready to dive in and kind of talk? Why does drug testing matter?
Really, drug testing is not about catching people. It's more about prevention, safety, and protecting employees, employers, and the general public, in large. I've even seen cases where, in a case of especially with some of the larger companies, that sometimes even the dealers actually try to get hired on by those companies, because it's a good portion of drug distribution actually happens in the workplace.
That's scary.
It is very scary, and I know we had one local company a number of years ago where we got called out by the general manager of the company because he had a concern that he may have possibly had a dealer working for him. Ended up testing the entire department, um, and a good portion of that department actually tested positive for cocaine. Um, After going in, they terminated a number of the staff, including the alleged dealer. And after that, after doing some follow up testing with that company afterwards, the drug testing positivity rate dropped down significantly, and especially eliminating. We really didn't see much cocaine positives after that.
Yeah, definitely. You see a change when you make just small little things of paying attention and noticing things, which is an important part of the drug testing um, program, is being able to recognize those those situations where something just doesn't feel right.
Very true. One of the things we definitely seen is companies that have a strong, consistent testing program often see, fewer accidents, much better productivity, and improved trust in the workplace. I know we had a company that we work with in the Midwest part of the United States that is a manufacturing company, um, and when they initially were not doing any pre-employment testing. They were not doing any random testing. They were strictly limiting their testing to post-accident injury testing and a little bit of reasonable suspicion testing. Uh, and they were noticing a significant spike in accidents in the workforce. Um, and when they were sending those people in for testing, also realized that they had a significant number of those accidents. Um, the employee was testing positive. Um, they had asked us, they had actually multiple plants, and they asked us to come in and do a sweep of all of their plants. When we did that, um, first actually was the first round that we did of testing their employees. Over 10% of their workforce tested positive, or either tested positive, you know, quit on the spot, or we actually caught in the process of trying to bring a substituted specimen in. And so when that happened, um, it was actually kind of eye opening to the management, though a couple of them actually realized, actually, a couple of their managers said, well, we really are not that surprised. But when we start looking at the positives, it really was from some just some of their basic entry level crew all the way up to some of their engineers that they were findings, and it was not any one drug. It was really almost everything. You were seeing marijuana positives, cocaine positives, methamphetamine positives, and you know, opiate, opiate positives. So it really was not even any one drug, and these were actually in, the companies were actually based in some very small rural towns west. So this was actually a very significant employer in those towns.
You mentioned that they weren't doing pre employment drug tests. And we hear this a lot from companies when they start to realize that their applicant pool is the first question out of their mouth is, do you do pre employment drug testing? And if you say no, they're like, okay, where do I apply? That's kind of a trigger to say, why are they all of a sudden so eager? If I had said yes, would they have said, okay, thank you, and hang up?
And really, that's actually the funny thing is after we did that first round of testing, um, that the HR person actually came back to us and said that's exactly what was happening with that they were getting a lot of calls, and when they asked about the pre-employment testing, they told them no. They're like, okay, I'll be right over to put an application in.
Yeah, and you should be concerned of eager people who are excited that you're not drug testing. That that does definitely say something about the pool that and the reputation that a company might have. And that's not necessarily a good reputation to have.
It definitely is not, because it basically does affect the image to the public. Same thing is even on a post accident situation. Um, that when the news catches, if the news comes out, if it's a serious enough accident, if your logo be on the side of that vehicle, people are going to say, hey, what happened here. Like you said, even going back to this Midwest company, that they actually had terminated everybody on that first round, that they saw that problem, including some departments that they literally lost two-thirds of the department. But after that first round, they actually had told me that the very next day, they actually then caught one of their employees out in the parking lot smoking marijuana. Also, several of them who were bragging about how they
How they
passed
cheated.
how they passed the drug test. One of the problems that we actually ran into that day, and we had actually warned the managers up front, was when it came to about lunchtime. We were not seeing as many people that we thought we were going to see in the morning. At, and then we said, okay, hey, please, before you send these people to lunch, let's have them tested. They're like, no, 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 we have to send them to lunch at a certain hour. Um, as soon as that group came back from lunch, we saw the number of people we caught trying to cheat on that drug test spiked dramatically. We were catching a lot of people because they went home and they were bringing back somebody else's urine.
Those are definitely testaments to why drug testing is important and why from a safety perspective that when it can be that prolific within your company, and that is not a culture or a um safe environment from a business perspective that you want to have.
It is. And what we saw, on this was after we did that, I kept referring to as the first round because they asked us to come back one more time a couple months later, especially because they had heard so many people bragging that you know, that they cheated on this first test. And we actually went in and did all oral fluid tests on the second round, and roughly about another 8% of that workforce actually then tested positive. But since then, that company, of course, enacted pre employment testing, they enacted random testing, and the overall effect of it was one that they actually were able to reduce their staff, the number of employees, because they were more productive. They could do the same amount of work with
Right.
less employees. They were getting into less supervisory diverted time dealing with problem employees. Um, and their accident rate in that company dropped dramatically following that. I
I
mean, and
definitely can see, yeah, better productive work, happier employees who are willing to get in there and do their job because the the people who are using aren't as productive, and that really aggravates the people who are not.
yeah, there's I've heard that multiple times from other employees who are, who test negative, who do not use, in fact, thanking us because it was more stressful on them having to deal with, you know, the drug using employees
Right.
because besides them having to now cover for them a lot more, they're also having to deal with, more, mood issues and personality issues, because of it.
Would you say that people who are using are out sick more or not, you know, do you get more call outs with that?
Definitely have a significant more absenteeism, you more tardiness. You definitely, definitely see trends that, on Mondays, more people calling in because they are still recovering from the weekend. You also, you know, see, we have see a lot more people who literally have to, who are now sick because they are now more susceptible to, some of the bugs that are out there.
Right.
But also usually, sometimes even one of the signs symptoms you sometimes will even see is literally the day after payday that
Hmm.
all of a sudden there is increased
Right.
absenteeism.
And I think it just in talking all about all of this and giving this example is we're not saying that, you want to, it's not about punishing people. It's about making sure that your environment is a safe place for everyone and that people are happy to come to work and are working efficiently. It is, yes, you are catching people on occasion, but you don't want to have that environment where it's unsafe for your employees and you can be putting your company at risk because one major accident can decimate a company.
And it's not even necessarily that when somebody tests positive that you necessarily even have to terminate that. There's different ways to handle it. Of course, using some type of counseling program to help people, to help employees stay off of it and kind of make sure they understand the importance of it. But usually, by the time an employer is seeing that there is an issue, that issue is probably significantly larger than they expected because
We
usually,
definitely see that all the time.
yeah, because a lot of times the user is trying to protect their job the most because this is where they're making their money to pay for the drugs.
Right.
Um, it is so a lot of times their family and their friends have been affected before this ever, before the employers actually seeing that there possibly is an issue.
Right. And we'll dive in future episodes, really talking about how do you recognize those types of situations and how you can help your employees. I mean, ultimately, a drug testing program not only protects the company, but it is designed to help your employees be better in all aspects of their life of recognizing that a person might have a problem and helping them and providing them the services um is an important part of that program.
And that is actually one of the keys that we actually see. Um, and it's actually kind of, you know, we look at reasonable suspicion testing. Um, Often when somebody does send somebody in for a reasonable suspicion test, there is a good chance that that person may test negative on that test. Does that mean you should not do reasonable suspicion testing? No, it definitely does not. What that may have done is maybe one, it was person really was using drugs, and the timing that management sent that person maybe a little too late, while it's already out of their system. Um, is one possible issue. It's also that maybe they're using a drug that is not on your panel, but also sometimes even more importantly, that the issue is not drugs. The issue may be that they are having some other personal issue at home, whether it was marital problems, financial problems,
Health,
problems,
health
yeah,
problems.
health problems, things that are, disrupting in their life. But sometimes maybe that conversation that you recognize there is an issue now may have actually got that employee to open up to you and probably really tell you what the root issue of the problem is. And once that employer knows that, that supervisor knows that, maybe now they can actually direct them to some assistance and actually get them some help, you know, you know,
For sure.
to help retain that employee and make them, that more happy, productive, employee again.
And I think as we're just talking through all of this, we want to make it clear that these issues happen in all sizes of companies. It's not just your big companies with hundreds or thousands of employees. These happen in companies who are 3 employees or, 20 employees. It can really, these situations happen to everyone, and they happen everywhere. We talked about rural America. We have clients in big cities. They all have the same. It's the same issues across the board. So drug testing really is for all types of companies, and we see it across multiple industries and um, types of workforce. It's not just your uh, blue collar, hardworking American employee. It's also your executives, and that drug use is not one size fits all. It is everyone is affected by it.
Very true. And I said we sometimes see that maybe the difference between between a somebody at maybe a lower income level to a higher income level sometimes is maybe strictly the drug of choice.
Exactly.
It's not that it's any less in whether it's white collar, blue collar work. It really is that it sometimes is just what that drug of choice
Exactly.
is.
And the other thing, I mean, just kind of wrapping up why drug testing matters to a company is, a good program. One of the big things we hear a lot is that it's expensive, but a good program will pay for itself. It's reduced accidents, it's greater productivity, which Gary touched on. It's maybe worker comp claim carriers will give discounts if you have a program and meet certain criteria for that program, and that's insurance premiums can be lowered. That can make a significant difference and really pay for that
Entire program
and beyond.
it does. I mean, I've seen in many states the work comp carrier giving a 5% discount, and especially in certain industries,
That's
5%
huge.
is huge. It is literally in some many cases tens of thousands of dollars a year.
Right.
That amount of money actually paid for all the testing and then some for the entire year, just that,
Right.
in
And
addition to all the other benefits.
and in that, I mean, yes, you're doing pre-employment for testing for every new hire, but if you have a safer, more stable workforce, you're not hiring as much either. So, that turnover can decrease. The, you know, And just again, that productivity and stability and safety of your employees is more than paid for with some of these discounts, or just overall, because you're not having as many issues.
Yeah, take a look at what to a company. What is your cost to turn over one position? When you start looking at what's costing you in lost productivity, why somebody's being trained, what was the cost of recruiting that new employee? How much diverted supervisor time did it take to get that new person up and running? When you start looking at the cost to turn over one position, that is thousands of dollars per position.
Right.
Time
Time and money.
it's huge.
Yeah. I think we've kind of touched now on why it matters, but let's talk about what are the 5 components of a testing program. There's really kind of 5 pillars that you need to be touching on, and we'll go through each of those here with you. Terry, if you want to
Yeah.
start with the policy.
Yeah, probably one of the central pieces you need to have is your drug and alcohol testing policy. Um, your policy is often going to be guided both by federal and state laws. Um, on a federal basis, there are certain employees that are mandated by the federal government to have a drug and alcohol testing program. Where we generally, will see that is in the U.S. Department of Transportation regulated companies. Who those are is your motor carriers, so your commercial, your CDL licensed commercial truck drivers. In the aviation industry, the FAA regulates not just the pilots, but other, other industry, other types of employees, such as some of the ground crew, the maintenance personnel, but it even extends into some of the manufacturing companies of some of the key safety sensitive
Components.
parts that are helping repair those and inspect those parts. So it really goes to a very wide level on the FAA basis. Then you also have the pipeline industry that is regulated, the Federal Transit Administration, which is usually are companies and government agencies that are receiving funding by the Federal Transit Administration. We often, probably the biggest sector of that is public transportation, like your city buses, your city light rail systems. They're all mandated to have a testing program. Then you also have your Federal Railway Administration, which is not just of course, it's the people operating your trains, but also the ones maintaining the tracks and also doing signal repair. And then you also have it's actually not part of the U.S. Department of Transportation anymore. It actually was moved to the Department of Homeland Security, but you have your United States Coast Guard. And when we talk about Coast Guard, it's not the military side of the Coast Guard. It is anybody doing commerce on the water.
Right.
Such as, fishing boats, dinner cruises,
Tour companies.
and of course, your big,
Your casinos on the water.
well, your casinos on the water, but also, the big freight haulers, moving,
Right.
oil and, goods, on the water, your merchant
Your
mariners.
shipping.
But so those are regulated by the U.S. Department of Transportation regulations. So your policy is going to be very specific to those regulations. And
So
then,
now you've kind of mentioned your regulated employees. Like, what do I do with the rest of my employees? Who mandates? Are there mandates for them?
so now you have your drug-free work, forces.
Workplace.
And your drug-free workplaces are going to be centered around state law. So every state you're operating in may have regulations in their, in state regs that say here's what you can and cannot do.
Can you
Now,
give a
not
couple examples of
so
that?
yeah. So not every state has regulations, but I'll just use like Arizona states that it's a voluntary law, but by complying with the their Arizona's law, you actually receive certain benefits. One of those, so things basically are saying is you need to have a policy, and that policy needs to have certain components in it. And like I said, those do vary by state, but it really tells you, lays out who is subject to testing, what the possible consequences are, um, what are you being tested for.
Does it even go into how you can be tested?
Yeah. So even, we'll get into on testing is even the particular methods for testing, but it really lays everything out in writing, for both your employees and your management. So really it is your blueprint for your program. So, when I say there's some benefits, whereas like, state of Arizona does allow a work comp carrier to give that 5% discount. But also if you do, in the case where like Arizona is a right to work state, so a company cannot deny a workers' comp claim based on a positive drug test, but they can terminate somebody and deny them unemployment benefits.
Interesting.
Um, but there also will give a level of protection to the company against being sued by the employee.
Okay.
So there's definitely protections in that. So really need to, so every program you need to have that policy because you really need, because basically if you're ever challenged, you go to an administrative judge, what are they going to say is, where is it in writing? Well, your policy is that. And of course, you need to make sure that your employee has reviewed it and that you have a signature stating that they have reviewed that policy so that they are aware of that policy.
And I think that goes into one of our next components is employee training and knowledge is you are required, you have your written policy now for your company, but you are required to make sure that your employees are aware of it. You can't just have it and kind of under the table. Like they need to know when or why they are going to be tested so that they are aware. And as you said, you need to have a written signed statement that they have received the policy and are aware of the policy and understand the policy.
Yes. And then also we often will tell companies that a best practice too is to, in safety and employee meetings, at least once a year, that should be a topic.
Right.
It may not take up the entire meeting, but it is to remind your employees that yes, we do have a policy. Here is the basic components of that policy. Because we talked about earlier, this is about prevention.
Exactly.
And sometimes that is just a reminder to employees that when they're out and somebody offers them something, and just having it in the back of their heads, knowing, hey, wait, there's a possibility I may get
I might have a
tested
test on Monday and I don't.
Monday, and that may just be the reason for them to use that as an excuse to say no.
Exactly. And it's just overall making sure your employees understand the risks of use. I mean, they need to know that if they are using, they have that potential of losing their job or, being restricted in what that they can do on the job. And that is part of that education piece of making sure they understand what the consequences are, what the tolerance is, and that they could all of a sudden show up to work on Monday and find out that they are being sent in for a random test.
And one of the things that we definitely advise, our clients, and when I'm writing policies for companies, I don't like to write a policy that is just purely punitive. I like to make sure they are educational and gives those clients, those employees resources for help, knowing that, hey, if I think I do have a problem or I know somebody has a problem, here's what I can do. Here's resources I can send them to. Here are possible counseling companies that we can go to. One of the things we'll talk about in a minute is the employee assistance program, um, but which is a resource for the employees to go to if they think they do have an. So you know, so you really need to have your policy. And like I said, that kind of circling back on the policy is that one policy company may have more than one policy because both a regulated and a non-regulated your drug-free workplace, they are different regulations, and you may have to a policy for your regulated employees and then
Right.
have a separate policy for your drug-free workplace, all your non-regulated employees. And then in many cases too, your regulated employee also needs to be subject to your drug-free workplace policy, because there may be some differences between that, because there's certain reasons under the federal rules you're testing that you may be testing additionally in under your drug-free workplace. uh, and then of course, kind of going off of, besides just training your employees, one of the other components is you need to train your
Right.
supervisors.
That's kind of that next component is that supervisor training and making sure that they understand the program and are learning how to recognize some of those characteristics in an employee that may be of concern that they're using drugs.
Yeah, your supervisors need to know what is in your policy.
Right.
They need to know what the rules are behind it. They need to know what their role is. But also part of that too is they need to really understand what are the signs and symptoms they need to be looking for in order to send somebody in for a reasonable suspicion
Right.
test.
And on the federal level, that supervisor training class is a mandatory um, part of the program, and in many cases, it is a recurrent training where they need to be revisiting their supervisor training information every, is it 12 to 18
So,
months?
like Federal Aviation Administration will requires every 18 to 24 months
Okay.
that there's recurrent training. The motor carrier industry really says you need to have that training at least once, but a best practice is for more frequent recurrent training to kind of refresh yourself. And then when you get to the drug-free workplace programs, some states mandates that some training, some states do not, but it's still a best practice to have your supervisors go through some type of recognizing the signs and symptoms.
Yeah, and it's definitely we see in doing some training and talking with a lot of employers. I mean, they definitely are saying, I wouldn't have thought of that situation, or so it's really helping supervisors understand what to look for, because there are lots of little things that if you start putting it all together, you can see patterns. And um understanding what some of those things are helps that supervisor better do their job and manage their team.
And on a future episode, we would definitely will be taking a deeper dive into that reasonable suspicion um, training and those supervisor roles.
Right. You mentioned when we were talking about employee uh, education that the employee assistance program is another big component of your um, of a drug testing program. What is that, and how does that? fall into this?
Employee assistance programs can vary a little bit to, from the very basic to something that's a little bit more in depth, especially with the larger companies. But the employee assistance program, in short, is what resources do you have to get that employee help if there is an issue? And it's not just for drugs. It is
For
a good EAP program. One sometimes is actually covered under your company health insurance benefits.
Right. I know a lot of insurance companies will offer free hotlines or you know, services where employees can reach out and try to get that guidance of where to go or how to um, deal with whatever their situation.
And in larger companies that probably have a little bit more of a budget, they will have, in addition to just what is given under their company health program, they will actually have a separate contracted employee assistance program, which kind of in short, if you ever hear the term EAP. But I started to say that it's not just drugs; it could be financial issue, helping people get counseling for financial issues, for marital issues, for possibly even just health, anything that, sometimes a good counselor that somebody needs, whether it's not even just affecting them, but something affecting their family
Right.
that is, and
It's
that's really what
stress,
that
it's depression, it's all those things that people are going through, the things that we hold on to, and affects our daily life.
So it really, the EAP program, the employee assistance program, is a resource for employees to get help. Because like I said, we don't need this to be punitive. It's how do we get a happier, more productive employee who, your, company showing that yes, we care about you beyond just, why you are at work.
Right. And then that kind of leads us into the last major component of a drug testing program is the drug testing itself. But there's a lot that goes into that part of it too. It's, the reasons that you're testing. Can you go over a few of those?
So drug testing is the cornerstone of, one of the cornerstones of your program because it is also kind of the enforcement piece of it. It's what brings it together. And we can we can definitely squirrel off into lot of areas that this podcast today could take us
for hours.
We could be here all day. So we'll cover today just a few of the basic things, and some of that is kind of understanding all of our key roles, dealing with some of what's the mandated programs versus the drug-free workplace programs, the rules, the regulations, the testing methods, and what is the reasons to test. So some of those key roles that we need to kind of be looking at is one is your designated employer representative. Your designated employer representative is the person on the employer level that is responsible for the program. They are, you may have multiple people in a especially with a larger company, you may have multiple employees that have some responsibilities, but who is the one person,
that final decision maker,
which is considered the designated employer representative, that is actually mandated by federal law to have one of those. And you need that person to understand their role. That it is really important. I've seen some companies try to say, "Oh, we're just going to designate our front desk receptionist." Well, it's not really the best person,
right,
to designate, because it's not just the person who receiving the results, but what are you going to do with that result? What if a situation arises? Does that person know what they are required to do?
right. When there's a violation to that policy, do you want your admin person the one making the decision of what to do next?
Exactly. So, we always recommend that, the designated employer representative go through some type of training to understand both the rules and what their role is. One of the other key roles, of course, is the laboratories. Um, you know, who is actually
Doing the test.
doing the test? And there's different levels of laboratories, different levels of certifications to laboratories. And under the federal program, you have to be using what's considered a SAMHSA certified laboratory.
What is SAMHSA?
SAMHSA is a division of the United States Department of Health and Human Services, that it's the Substance Abuse Mental Health Services Administration, which has several roles when it's dealing with obviously substance issues, mental health issues, policy. But one of their responsibilities is going to laboratories that are requesting to be able to perform testing under the federal guidelines, and basically checking those processes, to ensure that you're getting accurate results with the highest level of confidentiality. Um, but there's, like I said, there's also what's considered CAP, which is the College of American Pathologists, certified laboratories. Um, they that's they are definitely very highly rated, but they cannot necessarily do federal testing. But you know they are definitely especially under drug-free workplace programs, they are they're equally competent.
And I think one thing to point out in a lot of this is the type of certifications that we're talking about for laboratories that are doing employment type drug testing is this type of testing is slightly different than some of the medical testing that you're doing.
Exactly.
We're largely dealing with urine and saliva type samples that it is different than blood work that you're having done with your medical doctor.
Exactly. So, like I said, there's different certifications of laboratories, and even certain laboratories specialize in certain types of testing. What types, what drugs can they test for, but also what, um, you know, are they a hair testing laboratory, a urine testing laboratory, an oral fluid testing laboratory? They may have multiple of those under one roof, but really making sure, and like I said, and the type of laboratory you utilize under your drug-free workplace program may be mandated by your state laws. So
Right.
you have to be paying attention to what is in the state laws of what laboratories you can use. Probably one of the other key roles we look at is what's a medical review officer. In most cases, and especially under the federal program, but even in most cases under the drug-free workplace programs, that is a licensed physician, either a medical an MD, medical doctor, or a doctor of osteopathy, a DO, who has undergone specialty training. But basically, the role of that medical review officer is that once the laboratory reports a result out they report it not directly to the company, they report it directly to the medical review officer. And that medical review officer is going to look at that result, especially on a non-negative,
Right.
and determining, um, is there a medical explanation for that substance to be a legal
Right.
reason for that to be in somebody's system, because some of the substances we're testing for may be legally prescribed.
Right. And that's the key role of that medical review officer is to look at the result and look at any legal prescriptions or things that a donor might be using to determine if there is an issue of use or abuse.
So that MRO, one of the, they have the ability to take a positive drug test and actually make the determination that it is going to be reported out to the employer as a negative result because that employee had a legal prescription to be utilizing that drug. They have a legal, it was legal use. And when we're dealing with employee confidentiality issues, that the employer does not necessarily is allowed to know what one of their employees is specifically taking.
Right.
But the MRO's function too is if he has a concern, even if that person has a legal prescription, but are the way they are using it or the side effects of that drug could pose a safety risk to that employee,
Right.
and to that company, that the MRO could report that result as negative, but do not recommend that the employee perform safety sensitive duties.
Right.
Or he may also possibly recommend that what is considered a fitness for duty test, where they are sending the test to a independent medical doctor who can review both the person's medical history
Right.
and what they are taking
And those medications.
and against what the job description for that position
person.
is, and make a determination: is this person safe to perform their duties, or do they need to be put into a different role while they are on that
Exactly.
medication?
So the MRO or medical review officer is definitely a very key component of your program, and you need to have, someone that is reviewing that because it is very complicated, and medications and illegal use of drugs, all of that has an impact on a program.
And also, we will also see that sometimes we will get a result from the laboratory that's inconclusive because somebody took some type of substance to help try to cover up
Use.
the use, and our MRO then has to make a medical determination how to handle it.
Right. And as you said, they are specifically trained by the industry for that role of being a medical review officer. It's not just that they are a doctor, but they have gone through specific training to be able to review these results and make determinations.
Exactly. One of our other key roles that we look at is the collection sites. And I will honestly tell you, in 29, over 20, actually, because of the number of years I've been doing CM before starting my company, in the over, 30 some odd years of this, collection sites are the probably our biggest concern, because if there's going to be an error that's going to happen, it's going to be at the collection site
Right.
level. When you look at the collection sites are really going to vary from whether it is a company like ours that specializes in drug testing collections, whether it's in our office or with our mobile drug testing units, or if it is a medical clinic. We see especially a lot of OCMed clinics, some hospitals, the
Urgent cares are doing work.
are doing them. That but often, who's probably the lowest paid person in all of our key roles is
It's the collector.
is the collector. The U.S. Department of Transportation does require that collectors go through a certain level of training and certification, but for a drug-free workplace program, that's not necessarily required. But also, we do see is like if an error is going to get made, where's something going to get questioned? It's going to be at that collection site level. And you do, as an employer, have the right to audit more collection sites.
Hmm.
Um, and, as a role of, we'll talk about, one of our next key, next couple key roles is, third party administrators, is that we are also helping a company um, review and sometimes we have to make a determination of, do we ever use that collection site again? Do we require that collector go through some
Corrective training.
corrective training? How do we make them better? Because there are times we have to cancel a test because of a collection site error. Because one of the most important pieces is that we know that we have an accurate result. We need to be, if the medical review officer is releasing a result that is being reported out as positive, we need to know with certainty that that person actually was using that drug. That's why
Right.
the level of laboratories we're using is important. That we have a medical review officer involved in this process is important because, in life, are you going to be 100% perfect 100% of the time? No, you're not. But when you err, we have to err on the side of the employee.
Right.
So if anything, you need to allow for a false negative, so you never allow for a false positive test.
And the key with the collection sites is we talk about a chain of custody of a specimen, and that starts from the moment that that test starts. And between the donor and the collector, they are making sure that that specimen that is provided by the donor is handled properly, sealed properly, shipped properly, so that we don't lose any integrity of that sample. And it's really comes down to those two people in that test collection. It's the collector and the donor making sure that that chain of custody is maintained all the way to the lab.
And that it's 100% complete.
Right.
All the boxes are checked. All the required information is on there.
The
All
signatures,
are
the
all there.
initials, all of that are there. You started to mention third-party administrators. Talk a little bit more
Okay.
about
So
that.
third-party administrator is a company, and my company is also considered a third-party administrator. Basically, it is kind of a independent company that is helping a company manage their drug testing program. We're in some cases acting as a designated, for a owner operator, we may actually be acting as their designated employer representative. But for a company that has multiple employees, we are the helping the advisor, the consultant, managing the program, where we can take all the different components, the laboratories, the medical review officers, the collection sites, the training providers, substance abuse professionals, bring them all together under one roof. But third-party administrators, you have to, look at what your TPA says they are going to provide you.
Right.
And it's still bottom line comes down to a federal audit. The company is ultimately responsible for their own program, but a good third-party administrator is going to help guide that company to make sure that they have a legal program, a very cost-efficient program. Because as a TPA, I can contract out with the laboratories, the collection sites, the medical review officers in large quantities for pricing. That
Right.
it's often in probably 99% of the time, it's less expensive to come to me as your TPA than it is to try to piece all those components together yourself.
And I think that's where we started this podcast, because we know that, as employers, especially in smaller and mid-sized companies, you're not professionals in that drug testing world and understanding all the ins and outs. And a good third party administrator can really help you hone in on those important aspects of your program. And when issues do arise or you have violations, we can help talk you through um, those types of situations, or if you're being audited by an agency, we can help you pull together all of that information. That's what a good TPA is going to be able to do for you. And I think as a best practice, if you are using a TPA, you want to make sure that they have that ability to do all those extras for you, because you're running a business. You aren't necessarily, especially in smaller companies where we might be working with an owner or a safety um, person. Their job is to run the day to day of their company, not be this HR expert.
Exactly. To be that drug testing expert is how many companies can afford to have a person on staff that is dedicated strictly to running their drug and alcohol
Right.
testing, which is why there is a need for the third party administrators.
Exactly.
And as I said, they're all third party administrators are not created equal. Some will do certain aspects. I do see, some ones out there that are, they may they may help manage your random drug testing program, but they are basically having the laboratory, they're not bringing the laboratory, they're not bringing in the collection site.
They may not
They're
even
they're
have the
they're
medical review
yeah,
officer.
they're not consolidating sometimes even everything into a single invoice. What's the cost of that? And then of course you'll see, one of the other key roles here, and sometimes, where I'll be both, but is what a consortium is. A consortium, there are some third party administrators that are also consortiums, and there are consortiums that are not third party administrators. But what a consortium is a organization that is taking employees from multiple companies and combining them into a single random drug testing pool for the purposes of complying with the federal regulations, drug testing
Right.
regulations. We'll get more into future episodes on your random testing programs. Um, but basically, a company, especially these owner operators and these small companies, where they are mandated by the federal law to have a random testing program and to be testing a certain percentage of their employees annually for drugs and for alcohol. In a small company on its own cannot does not have the number of employees to be able to effectively do random testing by themselves.
Right.
So a company like myself that also has consortiums, in when we have consortium, our consortiums, we have a separate consortium for each different mode,
Mode.
because each mode may have different random drug testing requirements under the federal regulations.
Right, because some modes of transportation are only testing for drugs. Others are drugs and alcohol. Those percentages can be different. So it really is making sure you're in a consortium that meets the needs of your particular company and industry or mode. And there can be consortiums that are non-regulated as well. Again, you need to make sure that it meets the requirements that you are looking for or require or need.
Exactly. And probably our next podcast that we're going to do, we are going to take a deep dive into the random drug testing rules and the roles of those consortiums. Um, but the so yes, a company can be multiple of these roles that we're talking about. Other roles that we also dealing with is your training providers. Who is helping with your employee training? Who is helping with your supervisor training? who's helping with train your designated employer representatives, whether that is a in-person training, whether that is online training, or there's some type of package that software package somebody is
Right.
providing you, but you know, having that training provider.
I think the
Um,
key there is with training, and we talked a little bit about like supervisor training, is the DOT has specific things that have to be addressed in that training. So it is important that, in your training provider, however you are doing that training, is that you're making sure that that training meets all of the requirements um, for that type of training.
exactly. So other key roles we look at, of course, is your substance abuse professionals. Your substance abuse professionals are generally trained counselors, sometimes doctors, um, who, in case there is a non-negative result, a positive result, or a possibly refusal, who is, in case there is a violation, where are you sending that employee to if you want to help bring that person back to work?
Hmm.
Um, the U.S. Department of Transportation program mandates that before anybody who has a violation is allowed to return to safety sensitive duties, they have to go through a substance abuse professional, which then opens up a return to duty and then
And a
a
follow-up
follow up
plan.
program, which is something we will take a deeper dive into at a later date. But your SAPs, your substance abuse professionals, are those trained, certified counselors under the federal rules. Under a non-federal, there's a little more flexibility of that, but I still always recommend using
Again, that best practice.
best practice.
Best practice is to utilize those individuals to help people. Because again, going back to where we started, is the goal isn't to punish employees. The goal is to help employees and create a better environment. And I mean, at minimum, when there is a violation, a best practice, and in DOT it is required, you don't have to maintain that employee on your staff, but you do need to provide them with information to um
You need to provide them a resource. You need to provide them the
exactly.
name, address, phone number of a counselor. Even if
Right.
in one hand you're handing them
Their pink
the
slip.
information of who that SAP is, in the other hand handing them their pink slip.
Right.
That is a definitely requirement of the federal program.
And
And so,
again, a
like I said,
good best practice.
exactly. And then we talked about, the other role is your EAP providers who are, sometimes that substitute professional is an EAP provider, but sometimes, like I said, that EAP provider may be a little bit of a larger component, um, on, just, than just substance abuse. It's
Right.
other types of counselors that they bring in. So you will find that in the industry, there are people who wear, such as ourselves, who wear multiple hats. Um, you know, we are, my company, we are a collection site because I own 6 collection sites in Arizona. I have a fleet of mobile drug testing trucks that go out in the field. Um, is one end of our business. We are a consortium. We have consortiums for every different US DOT mode, and we also have a couple non-regulated
Right.
consortiums too. We are a third-party administrator. I do
We offer
maintain.
training
I do offer training.
programs.
I do have a medical review officer on staff,
Right.
um, and then we do help refer out, to some of the other where I'm not a substance abuse counselor, I'm not a substance abuse professional, but we do have the resources to refer those out. I say with our company, I don't sell somebody a drug test. I sell the service behind the drug test.
Exactly.
Um, So sometimes when you look at your providers, what are they bringing you? As I said, you have your med clinics out there, your urgent cares, who many of them, they are a collection site. They may have the laboratory under them, they may have the MRO under them, but they may not have the random testing program. They may not be able to, be that advisor, that counselor. Why there are some out there that do, there are many out there that do not. You need to kind of look at what is best for your company
Exactly.
in picking a provider.
Exactly, because we work with all types of companies, and we talk with lots of companies that have varying levels of knowledge and ability. Some of these things some companies are able to do internally. Other companies, they need somebody who can do it all for them. It's really, what is it that you are looking for, and making sure that the company or companies that you are working with are meeting all of those needs.
Exactly. Which kind of gets us into, we kind of refer back to as both Department of Transportation regulated and drug-free workplace programs. That under the federal law, there are industries, that are regulated by the U.S. Department of Transportation that mandates you have a testing program in order to be compliant. And in
For
all those
your
agencies,
employee, but that is for your employees that work under those regulations. Because we work with companies who, they may have, say, 5 or 6 truck drivers, and then they have 100 other employees that don't meet those DOT requirements.
exactly.
So that's where you can absolutely have multiple
And then
programs
I
and
also have
needs,
companies that fall under
multiple modes.
multiple modes. In some cases, it may be that employee A is motor carrier only, employee B is pipeline only, employee C is federal aviation
Right,
only. But and then some cases, employee A is regulated by both motor carrier and by pipeline.
right.
And you need to know how to handle that, because there are rules that do allow for combining that. And but sometimes, like I said, we'll take a deeper dive into that at, on a later podcast. But there are rules, that do govern that. But I said, then you have your drug-free workplace program, which then some of your regulated employees may fall under because, using an example is post-accident, that a the Department of Transportation, each agency defines what is considered an accident that you are mandated drug and alcohol testing. Um, and using motor carrier, which is the largest, what is a reportable accident that requires a drug test? It is one that either involved a fatality, e- or that a vehicle received disabling damage that required the vehicle be towed from the scene, which in that case requires that the driver be cited for a moving violation,
Right.
or that there was an injury that required that person to be receive medical attention away from the scene, generally meaning they were taken away by ambulance. And again, that your driver was, received a citation, um due
Right.
to that they had a fault for that. So under federal motor carrier, those are the
Only
acts.
3
So the only
reasons.
reason, fatality, vehicle being towed, or somebody being taken by an ambulance, were all the only 3 reasons. Well, what happens? And it also has to be done on basically a public roadway. So what happens if something's done on a private piece of property,
Yeah, your
or
guy backs his truck into the building,
yeah,
or
or
another
is
vehicle.
or yeah, or is or has a has an accident, backs into something that all the vehicles drove away, no one was taken away by ambulance, but can you still test that person under? And the answer is yes, you can, but not under the USDOT testing program. You have to test them under your drug-free workplace program.
Right.
So there is an overlap
And
of
you run
that.
into a lot of times in those situations is you have your DOT requirements, and then your insurance company is also encouraging that drug-free workplace program because they want to know from a standpoint of damage and coverage, how did this accident happen? Or was there underlying circumstances that they may be concerned with?
So the U.S. Department of Transportation program is very strict, but it's also the gold standard for most programs. Um, Basically mandating, that, the role of the medical review officer, what types of laboratories you can utilize, the roles of the collection of the collectors. Um, but it's also there dictates that at this point, U.S. Department of Transportation allows for a urine test, with testing for what's considered a 5-panel test, testing for 5 major drugs: marijuana, cocaine, amphetamines, opiates, and phencyclidine. That is the only 5 drugs you can test for under the U.S. Department of Transportation testing program. There is discussions out there. There's a proposal out there right now to add fentanyl to that testing panel. That has not, that is still in the
Very early
it's still in the very
stages.
early stages of approval. But they also, like I said, they also mandate strictly urine testing. Now they are going to allow in the near future for oral fluid testing, but that has been a very delayed process. And we'll probably go into that in a future episode a little bit more about where that stands. But at this point, only urine testing is allowed for drugs, and then alcohol testing either has to be breath alcohol or some saliva testing. But under the drug-free workplace program, there is a lot more flexibility, but that's also driven by what your state laws are.
Right.
And if you operate in more than one state, you need to make some determinations of, are you going to take each state and treat them separately if they have conflicting rules
Right.
or different or variations in their rules, or are you going to make a best practice that kind of covers the most restricted piece of every state under one policy? So your policy is going to be dictated by your state laws, but also is it going to be dictated is if you operate in more than one state, are you going to run one drug testing policy for the entire company, or are you going to have a separate policy by state? And that is a internal decision that a company needs to make. But under drug-free workplace programs, that would tell you what types of certifications your laboratory requires. But some states don't even have a law about it. So sometimes it is best practice. We get into medical marijuana and recreational marijuana. Under the federal Department of Transportation rules, it is still against federal law, and it is still mandatory that you test for those, and they do not care that it is legal by recreational or medical marijuana in a state. The federal rule supersedes the state rules when it comes to Department of Transportation regulated employees. But for your drug-free workplace program, you need to look at what that law is, where some cities, some states say you cannot test for marijuana, or you can only test for marijuana for certain job functions.
Right.
And sometimes that also, or how you're testing for it, which also kind of gets us into some of the testing methods that we're going to use, because we can expand out beyond just urine and oral fluid. We can use other testing methods in a drug-free workplace program.
Right.
Where
And
oral
all these
fluid,
methods have different
yeah,
merits of why you would want to use them and how you would use them.
exactly. So oral fluid testing is allowed in many states. There's definitely some benefits and drawbacks to every type of testing you do. Um, Hair testing is a great method of testing for certain reasons,
Right.
because it definitely has it has its pros and it has its cons. There are, we see it more in the judicial marketplace, sweat patch testing. Um, so, and then also under what is allowed is under the federal rules, we have to use a SAMHSA certified laboratory. All specimens have to go through testing at the laboratory. Whereas in a drug free workplace program, we may, depending on the state rules, be allowed to use a rapid testing device, considered a point of care device. And there's both point of care devices for urine, there's point of care devices for oral fluid, and we are also starting to see some point of care devices for hair testing
Right.
now. So a lot of it, and also what drugs you could test for, where the federal program mandates those 5 drugs, and that's the only thing you could test for. Drug-free workplace programs, I may be able to test for a lot of other drugs that are not in there. I could definitely, most states, will allow me to test for fentanyl at this time. Do I want to be testing for benzodiazepines or barbiturates or propoxyphene?
Right.
Do we do continent testing to see if somebody's a smoker? Um, so there's different ways to test, and you need to determine what is best for your company.
We'll definitely do another podcast just diving into what are all those different types of testing and the pros and cons of them, the
Exactly.
length of how long is something in your system utilizing this method, and are we looking at impairment or long-term use? There's so many facets to how we test and what we're able to test based on that information.
And sometimes the decision of what's happening is not just even based strictly on what your company wants to do, but sometimes it's dictated by a contract you have.
Right.
If you are a
See that a
contractor or
lot.
subcontractor for a company, you may be mandated by the contract you are in, that you are testing, but also how you're testing and what drugs you're testing.
And how often you are testing,
Yeah.
and
What's the reasons you're testing?
exactly.
Because there's different reasons to test. Are we testing for pre-employment? Are we testing for post-accidents, injuries, reasonable suspicion,
Randoms.
random, um, reasonable cause, return to duty testing, which is somebody has violated your policy, how to bring them back, and then follow-up testing.
Right.
And I have, there's companies that have to do mandate annual testing.
Right. Again, that goes back to sometimes some of your state laws or contracts with companies that they want to see a drug test of every employee every year.
Or there's even, pre-access testing where maybe you have an existing employee, but to be able to get onto a certain job site, that contractor mandates that you test that employee, even if that employee's worked for you for
20
years. So so there's lots of, so I can go into a lot of rabbit holes
Sure.
here, but obviously we are probably a little restricted on time.
And we really wanted, that's our purpose of our whole podcast is to be able to deep dive into a lot of these areas that we touched on today. And we touched on a lot of things, but just touched on them. There's so much more information. And that's really what we hope to be able to provide for you as we move forward with our podcast. And I think that's a good chance for us to kind of wrap up today where we're at and talk,
Exactly. I mean, basically, we were hoping this podcast helps you better understand drug testing in the workplace and what your role is. But as Lori said, we're going to be taking a deeper dive into the many aspects of drug testing. On a lot of our future episodes. This first podcast we really just wanted to make sure it was an overview of the testing program, because to understand it, we really do need to take a deep dive into some of this and really
each piece
of this.
So we hope that in that you follow us on Talking the Whiz quiz, and because we're here to listen to your questions and help give you the answers that you might be looking for and give you that deeper knowledge of your program and how it can and should work. Also, we hope that you connect with us on social media for any updates and upcoming episode topics.
And I thank you all for joining us today.
Thank you very much.